All right. Hey, everybody. Welcome to the LinkedIn Live broadcast. We're going to get the get this thing going here by kicking off the trailer. So let's get going here. Of course, I'm seeming to having technical difficulties. So perfect. All right. So well, hello everybody. Welcome to the LinkedIn Live Lunch Hour. I am your guest, Michael Goldberg, and we so welcome you to the LinkedIn Live show. And we have got a great opportunity here, or a great guest. And so, my guest is, well, that was the intro, but we're going to skip that this week due to technical difficulties. So my guest today is Dr. Terrence Kommal. And he is from Pretoria. He lives in Pretoria, which is right outside the capital of Johannesburg. Is that correct? Or is Pretoria the capital?
Pretoria is the capital.
Pretoria is the capital, yes. And I can say with honesty, you are going to enjoy this show. Terrence is currently serving as the YPO Healthcare Business Network as a Global Engagement Chair through 2021 and the Network Regional Chair in South Africa. He's a YPO Leadership Development Network and board member. He's a podcast host. He is Leader of Leaders podcast, Impact at Scale, which a lot of that we'll be talking about today. He has been practicing medicine for quite some time. He has met some incredible world leaders and has spoken at some major events. And we are so glad to have him on the show. Dr. Kommal, my friend Terrence, how are you, sir?
Very well, and you. It's such a pleasure being here, Michael.
Yes, no, I am super excited to have you on the show. And we have got just a whole list of questions for you today. But before we do that, I've kind of given you a little soft introduction. Why don't you tell us a little bit about yourself, your area of specialty in the field of medicine, as well as what you're doing for the community today?
Sure. Michael, by primary training, I'm a medical doctor, trained, board trained and certified in anesthesia and in intensive care. But I also then trained out at Mayo in neurodiagnostics and epileptology. But my core business is in the medical legal space. My core investments are in what you would call IME, or independent medical examinations. But I don't restrict myself to that core business, because I think in creating value, it's not just about what you trained in, but about where there's needs and opportunities to provide greater value. So I'm very involved in leadership development, healthcare strategy, policy, both public and private. So I wear a couple of hats, not healthcare limited, but a lot in the leadership space and nonprofit also.
That's great. And in terms of, why don't you provide an update? I mean, all we hear is news here in the United States. We hear about some global impact, but not much. So how are things going right now in the country of South Africa? And maybe you have knowledge even to the north of different areas of countries in Africa that may or may not be experiencing severe problems like the rest of the globe.
Sure. I think South Africa is a mixed bag of experiences, because it has first world lifestyles and infrastructure, but with third world challenges, right? So it's great to tell individuals in South Africa, wash your hands, stay at home, eat nutritious food, when a large amount of the population with an unemployment north of 25 to 30%, probably higher, without being measured, is below the breadline. So you've got third world challenges of extreme poverty and a legacy and history of apartheid. So you have infrastructure and systemic challenges. So in terms of the COVID crisis, it is a significant problem, because our country has been on lockdown since late March, which we had probably a day or two for people to prepare from the presidential proclamation, very similar to the rest of the world. And I think government is doing as much as they can. But here's the challenge. Our cases uptake is very slow at this point because of aggressive management by government, but also potentially because of undertesting. And government may obviously have a view that we are testing as much as we can and we're aggressively monitoring. But I just think, like everywhere else in the world, the more you test, the more you're going to find. And it's early days for us. So the mortality has been low. So the treatment opportunities and patients recovering are very high. But South Africa is in a little oasis, if I could call it, for Africa, because we have amazing healthcare infrastructure, economic infrastructure, and operational capabilities. Typically, as they call it, Africa Light in the rest of Africa. But you then look at the rest of Africa, which has significant infrastructure challenges, opportunity challenges, and treatment facilities. They're in a lot more complex circumstances. But here's the catch. We joke about it with our colleagues, tongue in cheek, we're saying statistics in country X, Y, and Z in Africa are low. It's not because there's probably no infections. There's a massively low rate of testing. Because when you're in the global pecking order of getting resources and reagents and DNA PCR testing machines, not everyone has that infrastructure in the rest of Africa. And even if they do, they don't have the financial resources or necessary human capital to make it happen as quick as we do in South Africa or in the rest of the world.
Yeah, no, I mean it's impacting everywhere, and I think one of the things that we definitely want to talk about today is really the long-term business impacts that COVID-19 is having on the economy, not just here in the United States, but all over the globe. And so, I think probably the first question I have is, what do you see as, some of the major changes that we are going to experience as an overall society after this, as this either continues or until a vaccine is found? Is there any, what's your insight to that?
I think, Michael, the big changes I'm going to see is people focusing on improving healthcare and improving health opportunities to limit their exposure. But we're on a precarious cliff between economic challenges contrasted with challenges of healthcare. Because, in the African context, the contrast is between, are you going to die of starvation or are you going to die of the COVID crisis? And it's finding a balance between that. And I don't think it's an African problem. I think it's a global problem. And India has that massive issue because in the US and South Africa and the rest of the world, you had some degree of notice that lockdown was coming. India shut down with zero notice to anyone, which has massive repercussions for people who live on a daily wage and people on a daily breadline. So I think it is a major issue. The opportunity is the world is now unified in saying we've got to find common solutions for common problems. And I think it in recorded history, it's probably the first time outside of the world wars in which you have a common thinking of saying, maybe we need to relook at how we do things. Healthcare being front and center, a remodeling of how the economic models are, and a review of what's really important. And that's starting in the micro environment, saying we need to probably spend more time with our families and know what's going on at home before we start looking outside of our communities, countries, and borders.
So, I know when we were talking, about, the United Nations has the Sustainable Development Goals. So kind of talking through that, what are some of the ways that we can create impact by looking at the UN SDGs?
Sure. I think the biggest thing for me, Michael, when it comes to the UN SDGs, is it's a broad blueprint of saying this is where we are as a world, this is where we are as a community. But the core areas, whether it be the education, whether it be healthcare, it be unemployment, equal opportunities, and the removal of discrimination, amongst the various 17 core areas, we have to ask ourselves is, have we been focusing enough on what is commonly called at the World Economic Forum, stakeholder capitalism? Who else has a vested interest in what we do as businesses? Who has a vested interest as what we do as operations, as individuals, as employees and employers? Because the reality is, if we don't start considering in detail what we do as leaders in business, those community needs directly and indirectly will impact what we do. very much so in this COVID crisis, when you have people starving on your doorstep or people with limited resources, that will directly impact your resources as a business and also impact your resources as a community, because there is a collective need to focus in creating good. I think profits are great, right? But sustainability is looking beyond what's your own pocket and your own bottom line.
Yeah, I mean, and so I guess, and for those of you, can you explain to the audience what the USDGs do, or what they were developed for, so that people kind of understand some of the initiatives that they've put in place?
Sure. I think the United Nations Sustainable Development Goals are 17 core areas in which the world's community and the world's leadership have come together politically and policy-wise and said, these are the key areas in which we need to start contributing. These are the key areas in which we need to start focusing in eradicating poverty and creating a more equal and balanced society. The agenda is by 2030 to be able to reach that, to find what can we do as individuals in our micro capacity and in a macro capacity as countries to eradicate poverty, create greater equality, and improve quality of life around the world. So whether it's contributing to education, technology, innovation, opportunities, and reducing inequalities in every possible sphere of life, the UN has said this is broad areas and broad themes. And these themes, each country will then translate, whether it be climate change or any one of them, to local policy. So it's a broad framework and guideline of what people should be focusing on. For example, in South Africa, we have a national development plan, which is a political framework by the governing party, which aligns with the UN SDGs 2030. So countries create parallel structures as implementing the global thinking of where we should improve as a global community.
Got it. Yeah, I mean, I think when the key for us, I think, is really, it's good to have some kind of framework, and I think we need that, whether or not everyone believes that our country is doing is happy with our leadership or happy with their country's leadership or not. I think having some framework around this is really going to help us kind of chart the course for the future. The question is who's being held accountable for ensuring that these US SDGs get put into place and are actually being measured, looking at the results. Is each country responsible for their own set of SDGs?
Yes, I think besides each country being responsible, it's also each corporate that needs to start focusing, instead of a profiteering engine or a money-generating, value-generating company, creating value in what is called the green economy, what is sustainable, both for the environment, for communities, and the world we operate in. Because we've started to reach a point where we're all acutely aware that the current model that we have is not sustainable. So it's being able to find, how do we continue to create value both for shareholders as well as stakeholders who have an interest in what we do as businesses. So it's a blueprint, it's a guide, but colleagues or organizations globally are holding each other to account in terms of measurability, in terms of you call it ESGs, environment, sustainability, and governance. These are key indicators that now are part of your international reporting. Outside of annual reports, these are now your sustainable aspects that are critical to say we are good corporate citizens.
Yeah, and I think so COVID or no COVID, I think this is a must, because it's just a different world, right, that we're living in, and so I think that these SDGs will at least provide that framework, and hoping that that we start looking at things more simply rather than being so techno focused. What's your thoughts on that?
I think technology is a great enabler, Mike, but everyone says, and the common thinking now is AI and machine learning. The technology is not smart. It's the people behind it that make them smart, right? We've got to be able to strategize our use for technology to improve life and life quality for everyone involved. Because, giving you an easy example, and it's something out of a professor out of Harvard, Terrence Kommal, who's involved in this project called Narayana Heart Hospital, which operates primarily in India, but now in the West Indies. a normal heart surgery internationally will cost north of $200,000, and there's always a large co-payment portion from the individual and families needing those surgeries. The model that this hospital is created is a $2,000, sub $2,000 cost all in for the operation and treatment. And the focus is not on looking at your exact financials, but a self-declaration. And when we had asked purely from a business perspective in a business classroom saying, but won't people lie? The owner of the hospital group had said to Harvard, yes, we know they'll lie, but probably 20% will lie knowing how much they're saving, and we can buffer the 20%. So it's looking at sustainable solutions of saying, yes, you can make money. And there's a Dr. Shetty that leads the project who lives in India and across the world at the moment. He's made billions of dollars in profits in a sustainable initiative, which is almost a social enterprise. Because what happens is when somebody actually benefits and you've given somebody a new lease on life, a lot of these families come back and say, I want to pay for another 20. I want to pay for another 50, because it's still a fractional cost to what it would cost in the US or anywhere else in the world. So these are just it's one example of how a business can generate revenue, but also create meaningful impact and improve qualities of life.
Absolutely. So let's switch gears a little bit here, and focus in on returning to work, life as we know it. I mean, and certainly you're a part of the YPO engagement, so I'm definitely going to want your opinions on this, and what people are saying. Maybe what you're hearing globally. If you can't answer that, then obviously regionally in South Africa. So the big question that everyone wants to know, and there have been articles published in the Dallas Morning News here locally, that it's a big question that employees are saying, do I really need to go back to work? I've proven myself to work from home. I'm more productive, more efficient. What are your thoughts? And what are you hearing in your YPO world? Will employers require employees to go back to work, or are we going to be happy with the way things are? Because it's dangerous.
I think it is dangerous, Mike, but it's also unprecedented times. So, we have webinars across the world in various networks, various chapters, and various conversations. And sometimes you'd think it's actually too much. But I've tried to attend as many as I can, because sometimes you've got 10 events a day and you've got to pick and choose between where your time is and what you want to take from those engagements. But a common thread that I'm seeing and experiencing with our peers is the model will change forever. Being at work may not be a critical necessity. And I'll give you an easy example that's more home to you. Is I had a webinar discussion and I moderated a session with Stan Bergman, the chairman and CEO of Henry Schein, Fortune 500 organization. Mm-hmm. And we had an amazing chat with him. And he, besides the large number of people they've had to let go of in terms of trying to protect the sustainability of business, they've made sure those members and staff are provided their benefits, they provided their health insurance in the interim till we figure out what the new normal looks like. But even in his model, he said, Terrence, a lot of people, from my understanding, lived in Long Island and they need to be company-centric and travel to work and spend 2 hours in traffic getting to there, only because the organization wasn't sure whether they wanted to, over the last decade, change the model because too much change could risk the business. And in the last 2 months, he's found that a lot of people are actually very productive, but a fair amount of the income goes into expensive real estate in New York State, the high tax rates and all of that, and the associated factors of where they work. But he's now saying, but Terrence, maybe we need to let people live where they want to live. Come in for a weekly or a monthly meeting. Let's regroup. But do I need my sales team in the same office? Because if we can manage with them right now, going forward, maybe we can manage otherwise. That may have repercussion for real estate owners. But I think from operational business ability, it's proven we can work decentralized. I don't think it's going to change whether people come back to work. I think it's where they come back to work and how effective that's going to be is what we're looking for solutions for.
Right. And so do you have any ideas around those particular solutions? Have you given it thought? Has it been discussed amongst leaders?
I think amongst leaders, there is a massive move to decentralized work. in my own organizations and the organizations that I'm involved in, both as my direct businesses and investments and engaging with peers. I think the decentralized model is not only value for the employees, but also for the employees. I'm talking senior executives and CEOs around the world are saying, I actually like working from a comfy couch and a shorts and maybe a jacket on top of that. But I can be productive, but it's a reframing of what we've done. So I think it's probably going to be the largest shift in how we do work ever. We in the last 10 years, we've been talking about industrial revolutions. The last 5, a lot of conversations of fast industrial revolution. But in a post-COVID world, there is going to be massive restructuring of not just how tech can impact that, but how quality of life is going to fit into that bigger picture.
Absolutely. So, what's interesting is, Danya Gale. I think I'm hoping I'm pronouncing her name correctly. Her question was, that she brings up through her program. She asked, do I really need to return to work in a centralized format? And I think, honestly, I think the answer is no, which, you and I have had these sidebar conversations that, commercialization of real estate as we know it today, or commercial real estate as we know it today, could significantly change. Think about the millions of dollars companies could save in rent, cubicles, all office equipment, copiers, printers, all that stuff. And you could, for that cost, you could staff up a workforce.
Yeah.
Correct? Right? You could invest in new technologies. You could buy faster services. You could develop, have the research money to develop products if you're a products-based company. So, what's your thoughts on that?
I'm all in favor for that. I can tell you now, Michael, I've got offices across various states, or what we call provinces in South Africa. And we've also moved our model because we used to have rented offices in various WeWork-like kind of environments. And we've already now switched those to pay-per-use packages. Because why should I pay for 30 days when we actually practically only put in 2 to 3 days a month in that office? It's great to have an address, but now we pay you for a virtual address. You handle our calls. You redirect it back on our PBX, our cloud-based PBX, and we're virtually there, but practically not. But when we need to be there, we'll use it. So for us, it's a huge saving. We're seeing anything from 60 to 70, if not 80%, on potential just regional office savings, which will impact what we do for our staff. It's also going to help us in the short term of sustainability of saying, well, we're saving on rent that we don't really need to pay, and we're not getting out of contracts. We're saying on a month-to-month contract, we now want to walk and use that to start paying in salaries when staff are staying at home and saying, do I need to look at our unemployment claims, or are you actually going to pay us in between? And we said, we'll carry you as long as we can as a business.
Yeah, and what Danjio just said is more often than not, the answer is no, I don't need to return to work. And and thank you for the questions and comments, Danjio. I think, and feel free, by the way, to ask Dr. Kommal any questions that you may have on the show here, just by typing those questions in, especially in the LinkedIn Live portion. When we look at structures of companies, and let's say we all decide we're going to work remotely, or most of us will work remotely because it's not required for us to be there. Do you see organizations flattening out as a result, or do you see them, is this a chance now to create more lines of succession in terms of people in the companies that today? So in other words, do you think it's going to flatten the organizations or beef them up if they decide, hey, we don't have to go to work?
I'll be honest, I think it's going to flatten structures, because reporting in is going to work, but there's also the risk, right? Because when you leave work, your employer or the organizations knew they're imposing in your private time. Now that you can Zoom at 9 p.m. because it's urgently, suddenly we're always switched on. I can tell you the impact it's had on my family life. Initially, it was like, great, we're going to have more time. but I actually have less time now than I did pre-COVID because I'm always switched on. I'm doing calls till 9, 10, 11 o'clock on regular nights. And it's just because people are saying, well, Terrence, we normally would want to schedule a meeting in the office, but since we're both at home and we've got downtime, can we connect for this short meeting, which 5 minutes translates to an hour? And that becomes an imposing challenge for us.
No, absolutely. And I think I agree with you. I think it is going to be very flattened organizations. I think, when you look at, post Great Recession, 2008 through 2010, all these, there's been posts and blogs and videos done about all these great companies that came out of the Great Recession. The Airbnbs, the Instacart and all these delivery services, Uber, Lyft. I mean, all these companies came out post-recession. Do you have an idea or any feel for what the next group of companies are going to be that are going to be kind of the new purple unicorns out there that stand out above everybody else?
I'm guessing, and my money's on the gig economy is going to become a massive focus at this point, because instead of selling your time for a finite amount of income, you could very much in an Uber-like or Airbnb kind of model share your time across various initiatives. So if organizations are now going to move their model from output to outcome, you could be delivering on multiple projects. Because let's be honest, if you're sitting in an office, a side hustle and a second and third project needs you physically to be there.
Yeah.
But if you're working remotely and can do an 8-hour job in 3 hours, you're freed up 5 hours to do work for someone else.
Yeah, no, absolutely. And I agree with you. I mean, yeah, I'm on more, but I've started to set boundaries, and that'd be my recommendation to you, because you do have young kids, and to anybody out there, that I tend to turn off work at 6 o'clock. I've gotten into a habit of doing that between 6 and 7, just depending. And if I need to do some side work, I'll do some side work, but it'll be with me sitting with my family, since most of my kids are on their phone and my wife's on her phone or computer. Yeah. So we can all work together. But I think you do need to take a break for dinner and to spend time with your families and not go overboard, because I think from a mental health perspective, can't that wear on you?
It does. I think it's emotionally very, very taxing, because everybody's in an uncertain circumstance. And I'm not saying this just as a doctor, but everybody's talking to everyone about offloading their emotional challenges, their personal concerns, the uncertainty, not realizing that let's enjoy the time that we have with those who are with us. And I think it becomes more so when we start to see people having health challenges. And I mentioned to you offline, we're dealing with my dad's healthcare needs at this point. But life takes its priority outside of concerns of saying what's going to happen in a COVID world, what's going to happen in post-COVID world. I think what should be important is what's going to happen in our world right now and what's worth our time and resources immediately, because employment's great, right? But the net effect of employment is creating a revenue which sustains living and lifestyle. And quite often we get so engaged in the process of making a living, we spend very little time living it.
So let me ask you this. I mean, obviously, less than 100 years ago, we dealt with the Great Depression here in the United States. We had a president who was elected, who was Franklin Delano Roosevelt, who put in, rights for unions, more rights for workers. The New Deal is what it was called. I don't know if you're familiar with that or not, but the New Deal brought all this opportunity. I'm going to keep political opinions to myself, but it will be implied by the next question I ask. Yeah. Is there going to be something like this, the New Deal, or is it going to be a very slow recovery? Do you see a decline in people's overall incomes? And tied to that, do you agree that we're going to see the very rich and the very poor nothing in the middle? It's a loaded.
I think there's multiple questions in that, but I do think there will be a massive shift. I think there will be a massive shift in the way things operate. I do think there'll be a more conscientious approach to what we do, and I'm optimistic about that, because we start to realize when heads of states like Boris Johnson and others are directly impacted by the virus, and everybody's families are directly impacted by factors outside of our control. Firstly, I think there's going to be a massive shift to decentralized risk. So what they're calling G-local or glocal. So building economies within your own country, so you're not reliant on massive supply chains. It's happening in South Africa. There's thinking in the US. I know just today there's talk about Apple trying to shift some of their operations from China to India as potential moves to limit their risk. But there will be a change in policy. I don't think it'll be as massive as what President Roosevelt did back then, but it will be in each context, in each region, of changing how things are done as a normal process. Because even in South Africa, you have challenges where there was petty bickering and petty politics of mudslinging of wholly irrelevant things, and maybe sometimes relevant, and suddenly now the president is the ultimate champ. The other political parties are almost absent at this point because, one, they worried about their own safety, and now you see them trying to come out of the woodwork saying, right, but there's this problem, but there's that problem, but it's not even focused on what the crisis is. And we're saying, be relevant to the conversation. Don't criticize for criticism's sake. But their relevance is always trying to say, well, the power of the day needs to change. And we're saying, well, why don't you keep quiet and wait a bit? Because he's apparently doing a good job for now. He may not be doing the best job, but neither is any head of state. Hindsight's 2020. But
you're there. You froze. Oh no! You there?
Yeah, I'm here.
Oh, sorry, you froze. Sorry, you froze. So you were finishing up a statement. Can you mention the last two sentences you just went through? Yeah.
I think, Mike, when it comes to the economic changes, there will be a massive shift between the haves and have-nots. So you are going to have the rich right at the top and the poor at the bottom, because those in the middle class and the lower income communities don't have the reserve that the rich do. And the quickest thing that the wealthy or the rich, if you would call it, would do is protect their cash reserves right now and their asset investments. It will also expose that who are those who are masquerading as wealthy from those who are truly wealthy, because there are a number of businesses that I know of who've masqueraded as massively successful, built great images, and they didn't have liquidity to last the last 2 months. Which then questions, were those owners and were those businesses as successful as they had masqueraded to be? And I think so. There will be massive shift. Bless you for that, Michael.
Thank you.
But I think there will be great changes. There will be a new approach. I think there will be a new movement. I don't have the answers. I don't think anyone has at this point. But I do think there will be a big divide and that the pains will feel together.
Yeah, so and Janya's my question asker today, and I love it. She says, Doctor, what do you see as a timeline for companies to begin making decisions? And do you believe, there are two questions here. So that's the first question. So what do you see as a timeline for companies to begin making decisions? And I believe that she means on the return to work. And she also asked, do you believe this could cause a future rise in unemployment?
I think the short answer is now is the time that you need to be pivoting and considering what those decisions are. Because if you can work remotely, you should. Because you also need to start pivoting what you do as a business to ask yourself, how sustainable are we if we are bound by just being in the office? And obviously, some industries that's necessary. But you've got to ask yourself, what are our fundamentals? And can we create that value remotely? And in terms of unemployment, no doubt, there's going to be a massive impact. Not just in the US, not just in South Africa, but worldwide, there's going to be a massive unemployment because not every organization has the reserves to sustain what it does. And an easy example that we were talking about just yesterday with some friends is some companies are saying we as executives are going to take a 30% pay cut. The executive can afford the 30% pay cut. The guy who's on the breadline and lives hand to mouth is working 1 or 2 or 3 jobs. He can't afford 30%. And if you take away 30%, he's not just in a deep hole. He's going to fall off a cliff. and his recovery opportunities are almost negligible at that point. So I do think there are massive concerns, but it's also a great time for those who know they potentially will be at risk to start urgently reskilling. And there's tons of opportunities online on learning skills and picking up skills, whether it be directly from LinkedIn, YouTube, or online courses like Coursera and other platforms. You need to start seeing things differently.
Absolutely. So, I mean, would your guess be that if you had to pick a percentage of total global unemployment, are we somewhere in that 45 to 50% right now as a result of all this?
I'm thinking we're going to go from whatever the baselines are, at least 15 to 20% up in the next 3 to 6 months, at least.
Yeah, I mean, look, we reported U.S. unemployment at 14 point something percent last week, but that was just for April. So I think totally, I think total unemployment over the last let's call it 8 to 12 weeks has probably been somewhere in the neighborhood of 30 to 35%. But they're not going to. But of course, the administration is not going to produce that number because somebody wants to get reelected. So you may want to focus on other things. Anyway, that's my political statement. So one of my close friends, Bradley Richardson. Bradley, thanks for joining the show. Asked, how do you turn off work in a global economy? How do you turn off time zones? That's the hard part, I guess, when we were talking about, shutting down and trying to, take a break from work and not being tied to tied to your computer. Any thoughts on that?
I think that's my challenge that I have at the moment, because a lot of my board roles that I serve in YPO and otherwise are primarily US centric. So a lot of our times are, although collectively decided by our boards, most of our members are in US time zones. So when they're happy with morning times or mid-morning times, it's late evening for me. So if I get in a meeting at about 5 to 7 p.m., it's actually great, because it's great timing for the US and great timing for elsewhere. But if I had to try and get colleagues out of India or China on the same call, it's going to be early hours of the morning. So I think there needs to be a respect for mutual value and mutual time, and find a common ground in where those communications are strictly necessary, or can it be simplified over an email?
Yeah, and I think there's this urge to be more connected through voice and through seeing somebody on the screen. I think that's super important. In fact, speaking of, I've got a meeting tonight with a gentleman down in Auckland, New Zealand. So that means I have to stay on until at least 6 o'clock, which I believe is around 9 o'clock his time, tomorrow. I think you have to adjust when you're trying to do global business. But I think for right now, I think global business has obviously ceased to exist. I mean, global economies working together where trade, import, export, that's all. I think that's slowed down tremendously. I don't know if you agree or disagree with that. Thoughts before I ask my next question?
I think, Michael, very briefly, international trade has slowed down, but also it's pivoted to different things, right? So instead of moving goods and tech that we were in the past, large amounts of not just courier services and shipping, but also chartered flights are now carrying personal protective equipment across the world in an unprecedented volume.
Absolutely. So, and then that does make sense. I mean, supply chain is still a very big industry that is hiring here in the United States. I'm sure across the globe, right? Because food, PPE, water, medical supply, all medical supplies, need to go across borders across our own countries, right? And so I know that when I do venture out just to go for a drive or to get out of the house, there are a lot of logistic companies with their trucks out on the road delivering that stuff. So it's interesting. It's interesting to hear that. I don't know if you see that in in the outskirts of Pretoria or not, or you're completely holed in, so you don't know. I guess the next question would be, do we have the opportunity to, how soon will it be before we can grow our businesses again, in your opinion? Is it totally dependent on this vaccine? Or are we relying too heavily on the vaccine that may or may not ever come to fruition? It's just an upper respiratory infection, is my understanding of COVID-19. But there'll be other COVID numbers coming out soon, I would assume. What are the economies trying to do to research? What is the medical community trying to do to research to prevent other COVIDs from coming and attacking the way COVID-19 did?
I do think we're heavily reliant on the vaccine, and that looks like the silver lining that we're looking for, as all heads of states are looking and relying on the medical communities. The challenge is, like HIV, there's always the risk of mutation, which we're seeing already with the COVID-19 crisis. Is the virus just continues as almost, in inverted commas, like an intelligent mutation, to continue moving ahead, where you can't really pin it down. You can treat it but can't cure it. So there may be a potential future where we do have COVID crises, but we start to change our practice as a new normal. So maybe masks will become compulsory permanently. Maybe traveling in and out of home will be less frequent as it used to be, but more conscientious of what we need to do. I don't think that will be the permanency, but there's always that risk, because I think there's too many unknowns. So I don't think there'll be an exact answer of what it is. But the concern of other COVID crises and other pandemics is on the horizon. I think it's always been there, but everyone's looked at it. And to give you an easy example, the infectious diseases specialists and the doctors and the nurses in the hospitals were always seen as the people who were ticking a box. People are like, yeah, it's fine. Just give them what they want. They're trying to control infection. Now they're front and center and amongst the most important people in those facilities. And now everyone's listening. In my household, I've had good sanitary products entering my house just purely by virtue of the work we do. Now it's just been at an accelerated pace that has become normal elsewhere. I'm not saying I haven't improved it. We've done a lot more, even in my individual circumstances. But the direct context will change. The risks and the concerns for infections will also change also. And I think we need to start asking ourselves, when those risks are there and will always be there, do we need to continue the speed and volume of international travel and dynamic, environments as we did in the past, going forward in the future?
Well, I mean, that's the bigger question is, are we going to be able to go on vacation ever again? Or is this it? I mean, I'm sure we will, but being able to enjoy the niceties, I mean, number one, it could be that from a financial standpoint, as a result of the economic impact on this, many people won't be able to afford to go on vacation. Going on vacation, flying somewhere, whether it be to South Africa or to Japan or to a Caribbean island, is seen as a luxury that has now almost been taken away from a lot of us because we can't really afford to go there, number one. But number two, we don't want to go to a foreign country and either, if we're asymptomatic, provide or to share our lovely asymptomatic germs with foreigners, and then it becomes a problem there. Yes. What are your thoughts on being able to do the things we're so used to doing in the past, like going on vacation? Or do you see it just becoming an RV park world?
I think it's going to be an extremely optimistic time. I love my vacations. Just in, I was in Switzerland at the WEF and Davos conferences in January. I absolutely loved it. October, November, I was out in the US. We were out in Florida, and we spent some time in Cuba. I'm looking forward to my vacations and the rest of our travel, whether it's work or vacation only. I'm optimistic new solutions, new approaches will be found, because you cannot stop the entire travel industry. You cannot stop the world on living what it is. I just think it's going to be done very much more conscientiously and more actively, so to say, whilst we need to travel and want to travel and should travel like I want to, there'll be different ways and approaches to mitigate and or limit risks from a healthcare perspective.
Absolutely. So we are coming up on 11:45. This has been a great conversation, Terrence. I've really enjoyed having you on the show, number one. And number two, I've enjoyed getting to know you over the last few weeks. I was trying to remember how we ended up getting in touch with one another initially, and just I guess my brain has just been so full of different things that. Do you remember how, or was it by chance? Look at me sneezing while I'm
I
talking to
recall
the doctor.
it's you again, but I think we connected through a discussion on one of Mark Mentry's chats and reach and call outs, and I think that might have been the initial touch point.
Absolutely, yeah, that's right. So, well, any final thoughts or words for us? Any final comments before we sign off here?
Sure. I think, Mike, there's going to be a lot of changes, lots of turmoil, and lots of uncertainty. But we've got to remain positive. We've got to remain positive for ourselves, our families, the future, and the world, because it's only when we remain optimistic will we be able to generate that energy and the willingness to find solutions. I don't think we're going to have all of them as we think we will, but optimism at least makes the journey a lot better.
It does make it a lot better, and I think, and I think that's so true, Dr. Kommal. I mean, we have to be. We have to think through things differently. And I know, like, some of the things, like when I'm working with my job seekers, in fact, we talked about it last week, was having this positive mindset during these uncertain times, especially for those that are seeking their next opportunity, that instead of saying, I've applied to 10 jobs and nobody's gotten back to me, and so that must mean I'm I'm never going to find a job, to, hey, I've sent out 10 resumes. I understand that it's probably going to take this person a while to get back to me or to review my resume, because I understand they have a lot going on as well.
Yeah.
Right. And I think that's the kind of mindset you want to really focus on as a job seeker, or even if you are working and you're just feeling like you're trapped. You have to think differently and think more positively. Because sitting there watching the news or reading the newspaper every day, or hearing the sad sack news and whatever you want to call it, especially here in the U.S., it's always quite interesting. But you have to keep your chin up. You have to focus on what you can control versus what you cannot control. Does that make sense?
Correct. Indeed.
Right. All right. Well, Terrence, it's been a fun-filled 45 minutes, and I've enjoyed talking with you. And we'll see you next week, on Friday, with our next guest. And certainly feel free to comment as you're watching this on the replay. And I hope you all enjoyed your lunch as you were watching this. And feel free to connect with Dr. Kommal on LinkedIn. And it is Dr. Terrence Kommal, and then he's got some big acronym after his last name. I don't know what that's. ADELF? What is that? What is ADELF?
ASELF. ASELF is a fellowship for public healthcare leadership.
Got it. So, and what's your podcast again? Plug your podcast.
Impact at Scale. So it's discussions for impact at scale.
Perfect. Well, thanks again for being a part of this, and we'll see everybody. Terrence, just hang on for a few minutes here after I end the broadcast. Thanks for watching. Be safe, be healthy, stay at home. If you go out, wear a mask, wear gloves. Any other ideas? Or is that about it? Does that cover it?
And I think keep your good social distancing, right?
Practice good social distancing. Try 7 or 8 feet instead of 6. It's always good, right? So thanks a lot, everybody. Hope you have a great day or great evening wherever you're watching.